I'm delighted to introduce Dr. Kunal Oswal, who leads the early detection initiatives at Karkinos Healthcare. Dr. Kunal has completed his master's degree in public health and health management from the University of New South Wales, Australia. With a fellowship at International Agency for Research on Cancer, IARC, and many years of experience with the Tata Trust, Dr. Kunal works very closely with the communities across the country. Dr. Kunal, a delight to have you here. As we begin, I would like to ask one question related to your experience on how we can make cancer care unique in community settings.
Thank you, Bharat, for the question. And it's right that when you look at cancer per se, the uptake in a country like India, the National Family Health Survey says that only 1 to 2% people come forward for screening. And there are a lot of literature, a lot of research evidence which highlights that there is fear, denial, stigma, access to care, access to proper screening facility. And hence what unique Karkinos brings in to the distributed cancer care model is a model which is embedded in the community, which is more collaborative, more community-centric, and more participatory. So hence, when we look at the model, how we can improvise on a community settings, right from identifying those barriers, why a person comes forward, why a person doesn't come for screening, what are the challenges they face in the settings, and how the health systems can be much more responsive rather than a traditional reactive healthcare system being much more prompt and preventive care can be embedded. We have done various programs in diverse settings in Kerala to Manipur, Jharkhand and Maharashtra. And it has given us a lot of insights that you can't have a one-size-fits-all. And hence, through Karkinos' unique model, a hub and spoke and further spoke model, it helps us to embed the health system per se. Participation with the community, participate with the government health systems, participate with the foundations, charity, or any philanthropic body who comes. The essence is a more participatory approach. Therefore, we are able to, have exceptional results through our approach and share those learnings with other partners as well, so that it can be much more holistic overall.
Thank you very much. Clearly, awareness is very important for us to consider in a community setting. As a follow-up to this, I would also like to ask, what would it take to design and implement unique cancer care solutions for community settings?
When we look at the healthcare providers who are an integral part of the entire ecosystem, it's much more, the traditional model is much more prescriptive and more of a symptom-based. Hardly there is any focus on preventive and promotive care. You can envisage that government is also quite actively, providing or budgeting for prevention and promotion of the healthcare. So hence our healthcare providers be a critical, role if we engage them right in the start of the program, when we are designing any community-based programs, when we are focusing on building their capacity, especially when it comes to cancer screening and early detection. In addition, they can also be critical role in post-cancer care, follow-up care as well. Most of the patients do complain of various side effects ranging from, mucositis, loss of hair, psychological well-being. All these private practitioners, which are there, it can be anyone. It can be general practitioners, it can be physician, it can be alternative medicine, which we call as AYUSH as well. It's critical that we involve everyone together in the entire ecosystem, because this will help us to break that reactive health system into much more upstream, which is preventive and promotive healthcare system. A health system which is SWAST, which can be Swanchalit, and which can be enabled at various miles across the country.
Thank you, Dr. Kunal. Awareness and empowerment of healthcare practitioners focus on early detection seems to be the key, and your message resonates with our previous speaker who mentioned fear is the lock and courage is the key. We look forward to more such initiatives and your talks as we move forward. Thank you once again for your time.